Assalamu alaikum. I welcome you all in the online lectures from DrNAS. I am DrNAS, Dr. Naveed Ahmed Sheikh, and today we're going to start the lectures, online lectures about the cardiology, and inshallah one by one we will cover all the topics from the basics of basic cardiology. So our today's topic is acute myocardial infarction. Without wasting time, we will rush towards our topic and we will cover all the essential things of acute myocardial infarction. In the first lecture, today's lecture, we will cover the universal definition of the acute myocardial infarction, the pathophysiology, the signs and symptoms, the diagnostic criterion on ECG of the ST elevation MI, and the other investigations for acute myocardial infarction, types of myocardial infarction, and the risk stratification, and what are the risk stratification scoring system of the acute myocardial infarction, and in the last but not the least, the immediate emergency management of acute myocardial infarction in the emergency room or the emergency department. So what is acute myocardial infarction? You know, in the world, the most common cause of the death, even that the majority of the deaths are caused by cardiovascular system, and in cardiovascular system the ischemia is the most common culprit. So what is ischemia, what is acute myocardial infarction, how does it occur? So what is the pathophysiology actually behind the acute myocardial infarction? And once we get through all these things, then we will move towards the definition of the acute myocardial infarction. So assume that this is the vessel valve. These are the coronary vessels. Okay, in your body. So what happened actually, it starts making the plaques. The plaques are like it's a atherosclerotic process in which the plaques or the cholesterol with the foamy cholesterol and other tissues deposited in your coronaries. So what happens actually, these plaques grow in your coronaries and start occluding your arteries, but until the flow is reserved in your coronaries, patient won't develop symptoms. What happens once this thin capsule of the plaque ruptures? What happens then? The blood goes in contact with the internal matrix of plaque. In the blood, platelets activate, okay, and the platelets activated by the other system or the clotting system of our body, and it recognizes it as a foreign particle. So they started a clotting process here by activation of the fibrin and other clotting system. Okay, so what happens actually, that when this clotting system and the clotting process activated by the platelets and by the other cytokines and by the other responses of our body, they produce a thrombus here and completely occluded our artery. Because of the complete occlusion of the artery, so the muscle which is actually supplied by this artery, like the myocardium, endocardium and the pericardium, you know that the coronary vessels